tried over the years to improve the convenience factor in our office for our patients and for ourselves as well. One of the things that we have is a kiosk in the lobby where you check in and a patient uses the insurance information and plugs it into the computer. The insurance gets verified. We can activate their files right away. We know that they checked in. We know exactly where they are in the office. We also have the convenience aspect of just recently we added a pharmacy. The patients need to have their medications filled, and sometimes that's very inconvenient. You have to either we call them in, which is a little inconvenient for the providers, or the patients take their prescription, they take it to the pharmacy, they either drop it off or they have to wait. Sometimes you have to wait a while for a prescription to be filled. Sometimes the pharmacist doesn't have it. So by having a pharmacy on our premises, that solves those kinds of problems. And we also have the supplements that are convenient for patients. Supplements that I feel would promote healthy living, vitamins, antioxidants, and we're adding to that. Each month we probably add a few more. We keep a catalog in the waiting area and also in the waiting room so patients can look at that and they can educate themselves about what's out there and what they might need, and that can bring up discussion in the rooms when I see the patients. We also have a complete line of organic skincare products that are environmentally safe, cruelty-free, and contain the highest quality ingredients. Our product line is made up of all natural ingredients that we developed to help maintain healthy skin.
Our supplement program, I believe, was Dr. LoCicero had researched for a long time to decide a compatibility to a company that's doing the right research. And when she came to the decision to go with our current supplement program, she wanted to keep in mind that it was cost effective, that it was a useful supplement, and she wanted a variety. To focus on the types of conditions that we deal with here.
One of our goals is to be able to provide medical care in an environment that is reflective of state-of-the-art. Patients have the ability to access their medical records without the assistance of our staff. And by that I mean that we have a website that patients can go to and in a secure environment log on to what we call a patient portal, and they can pull up their personal health information. They can review any testing that may have been done, review any notes that have been left by our practitioners for them, as well as be able to schedule appointments and actually print out their medical records for themselves without having to contact the office. Our websites provide a wealth of information about our practice and educational information on many health conditions. You can even purchase vitamins, supplements, and skincare products on our website and avoid a trip to the office.
They're ahead of the curve. That's one thing about the partnership between Nick and Dr. Karen is that they try to have the latest equipment, the latest tools available to them. It's neat to come in and have some of your blood pressure and other things taken and have them automatically loaded in a computer, and to have your health history pop up on computer so that everybody's on the same page. Medication refills are a little bit quicker and easier, and I think more accurate because things are somewhat double checked by a computer system.
Because I'll be able to go online and check my own previous doctor's visits, make my appointments, look at my blood work, and in the event that they make a referral to another specialist, I wouldn't even have to bother their office to get a copy of the last blood work. I could just go online, make a copy, and then go proceed to my next appointment. And that, I think, is great.
They're getting more involved with the patients, and they're making sure, I guess they're trying to find out, make sure they get the right medications, and they have their own labs that have the results done a lot faster.
It makes it so much more convenient. The last time I was here, I had a medication that I had to have, and it was like before I left the office, the medication had been filled right here. So that saves a trip to the drugstore. Taking a bone density test, you have it done here instead of going someplace else to one of their diagnostics labs. And I mean, it's so much easier to schedule the things.
You see a doctor, you get taken care of, you get a prescription, they put it through the computer. Before you walk out of here, you walk out of here with your medication. In fact, you can take your first dosage here. So what's better than that? You don't have to go to a pharmacy, leave it, come back 2 hours later, wait online, pay this, pay that. It's terrific.
I needed some support, a support system. She's my support system. She takes care of me physically. She's very alert to different things that she notices about me. I just recently had a problem with some serious anemia, and she followed that through. She always follows up on things. I mean, it's not unusual when you have a serious problem to get a phone call. If not from her, to get one from the office checking on you, which I like.
My main philosophy is to treat a patient as a person, not just a case, although sometimes I think all doctors tend to think of the patient with the whatever diagnosis, and we can see the patient in our mind and think of that one diagnosis. But the patients are people too, and they have their issues, they have their families, they have other things going on. Sometimes people really can't go by the book the way we want them to be because it's not realistic, because of whatever reason. They can't do what we want them to do, so we just do the best we can, taking into consideration their situation. Part of my philosophy is also prevention and preventing illnesses, or if somebody has an illness, to prevent it from getting worse, to try to do something. And there's some things you can't do anything about, which is unfortunate, but we just do the best we can.